and welcome to the Utah Public Health Laboratories, or UPHL for short. Chances are you haven't heard of UPHL, unless of course you're one of those people that's really interested in rabies testing, and if that's the case, you probably already work here. Much of our work happens behind the scenes, far away from public view, but our work affects every single Utahn. For instance, we conduct newborn screenings for every baby born in our state to help prevent 42 life-threatening disorders, giving the little tyke the best possible start at a healthy life. And we're fast too, with 92% of babies having their results back by their 7th day of life. I know, it's hard to believe that any government program could get anything done so quickly, but that's what people have come to expect from UPHL since we opened our doors all the way back in 1925. And don't think that after those first few days of life, we just forget about you. No, we assess and study a wide range of potential health concerns that can affect you throughout your life. For example, we work directly with the Department of Environmental Quality to ensure that any area of the state where someone lives, works, or plays is free of any chemicals or biological hazards that would impact health. The UPHL tests for contamination in drinking water, lakes, rivers, and any other large bodies of water so you can have fun and not worry about getting sick. And speaking of getting sick, we're responsible for tracking the spread of all sorts of infectious diseases. One of those is rabies. Rabies is ubiquitous across the United States and can be carried by a whole host of mammals. But the most dangerous to humans is bats. The UPHL will test any bat that comes in contact with humans or domesticated animals, and that's hundreds of bats every year. But of course, we test more than just bats. We also spend a lot of time around mosquitoes, so you don't have to. Our arbovirus lab tests an average of 6,700 mosquito pools every year for a multitude of different viruses. As you can see, we're big fans of germs, while studying them and the ways to prevent them. In fact, we're part of the influenza surveillance system, which helps to identify novel virus strains early on to help to determine the next year's vaccine composition. But of course, dangerous diseases can come from more places than just bats and mosquitoes. Food. That's right. In fact, scientists have identified over 250 different foodborne diseases that can cause symptoms ranging from nausea and stomach cramps to vomiting or worse. But we help make sure that the snack you may be eating right now is safe. In fact, one of the UPHL's main objectives is food testing. And I'm proud to say that we've been nationally recognized for our work in keeping the food supply safe. In 2018, we were able to identify that the salmonella contamination in different Kratom commercial products was the cause of an infection in several patients here in Utah and in other states. And it was our work that led to an FDA recall of such products. This is one of the busiest parts of our lab. Right now, behind these doors, our forensic toxicology department is analyzing body fluids and tissues for the presence of alcohol, drugs, and other substances. Let's take a look, shall we? If you've ever watched a crime show, you know that the tests we perform here help law enforcement solve crimes and aid medical examiners in determining the cause of death when necessary. Every year we process more than 10,000 cases and receive over 1,000 court subpoenas. But the average turnaround time is still only 3 to 4 weeks. That's nearly half the time than most labs in the industry. To keep up with the ever-growing drug trends, we have expanded and improved our testing capabilities. And because of these efforts, our forensic toxicology lab has more than doubled the number of drugs we can detect. After everything you've seen today, you're probably no longer surprised by how much we're actually involved in. But you've probably read about the work we do countless times and not even realized it. We're the ones that discovered the West Nile virus had arrived in Utah, found lead contamination in several public schools, and on and on. Yeah, we're busybodies. So, as you can see, the state program you've never heard of does a whole lot for you. At UPHL, we're much more than just a laboratory. We're a collection of committed and hardworking individuals dedicated to the task of keeping Utah a safe and healthy place to live, work, and play.